Now, if there was one policy more than any other that won Albanese the election, it was his pitch that going to the doctor would be free. He took out his Medicare card at press conferences, on leaders' debates and in television interviews, waving it around, pledging it was the only card you will need to see a doctor and that you wouldn't need your credit card.
It means, of course, that all they need is this little green card. All they need is their Medicare card. Every Australian will only need just this, their Medicare card. All they will need. When they walk in here, all they need is this, their Medicare card. That is all that you need. We want people to be able to see a doctor up to 90% and to just need their Medicare card, not their credit card.
And we even saw in Parliament just yesterday, Richard Marles also waving around a Medicare card, or it might have been the Health Minister, Mark Butler. They're still doing it. Yet in the news now is a survey from Consumers Health Forum of Australia. As the Canberra Times reports, medical care is becoming unaffordable for more Australians. Now, the survey asked 5,000 Australians in late 2024 about their ability to access the healthcare system. And 1 in 10 Australians said they couldn't afford medical care in the past 12 months. 49% said that on at least one occasion in the past year, they hadn't accessed healthcare they needed. 28% reported not being able to see a dentist because of the cost, and only 32% felt confident they could afford care if they became seriously ill. Now, the Consumers Health Forum Chief Executive, Elizabeth Devaney, said that the biggest barrier to getting healthcare was cost, and then followed by the availability of doctors.
Australians expect that if they need healthcare, they'll be able to get it. People shouldn't have to prove that they're struggling to get the help they're already eligible for. People are telling us that they simply can't get the care we need because it's impossible to make an appointment. The further you are from a big city, the longer you wait. And for rural communities, cost and access hit equally hard. So if you can't reach a service, how much it costs is almost irrelevant.
Cost and access. And she's asking the government to urgently address the affordability of medical care. On this crucial issue of being able to afford and access medical care, we're seeing a vast difference between Albanese's election promise and the reality. And it's not just this survey. The statistics show that Medicare bulk billing rates have declined under the Albanese government. The GP bulk billing rate was 88.5% in May 2022 when the coalition left office, and under Albanese, bulk billing has dropped more than 10% to 77.9%, and that's as of July this year. Out-of-pocket costs for GP visits have also increased to the highest level on record. So that's the difference between the spin of pre-election promises and the lived reality. And the reality is there's been no improvement in bulk billing. And 1 in 10 Australians just can't afford to get the medical care that they need. This is a shocking indictment on the Albanese government on their core election promise.